Dosha, Dhatu, Mala. We have seen what are the correct quality wise of their actions. If it is Vruddhi, what can happen? If Shaya Lakshanas are there, also we have seen into. So how these can be implemented in person or in a human, or Roga, the disease, in a Rogi, how to check into it. That is nothing but diagnosis of the element in the clinical examination of the disease as well as of the diseased also. Both we have to check into. Here we look into signs and symptoms along with the pathological assays, which will help us to diagnose the disease. The disease affects the host, is it not? So, depending upon his capacity, the person capacity or a human capacity, his Sharira quality of endurance, immunity, and many other factors, we check into it and find out the Roga conditions. Based on these factors, like the occurrence, when it has occurred, severity of the disease, chronicity of the disease, response to the scheduled treatment varies. Means all are interconnected. And that aspect will go through Roga Pariksha. Though the disease is exhibited in the body, the diagnosis of the disease depends upon the result of examination, like clinical or pathological investigations. Hence, the examination of the disease differs from examination of a person, though both are observed or carried in the same entity. Swabhava, we should check in what is the nature of the disease, or Roga, and Rogi both. Avastha, we call it as a stages. Here we divide it as a Purva Rupa predominal, signs and symptoms wise. What started first? What seen first? What complained first in the body? This has to be checked in. Rupa. Rupa is seen. What are the things seen for us? Chirakari, whether it is a chronic, Ashukari, it's an acute one. If that also is seen, but still we have to check in whether it is a Gambira, deep-seated, Utthana, superficial, Vyadigati, prognosis, depends on this, according to the Avastha. In Avastha, we see Purva Rupa, Rupa, Chirakari or Ashukari, Gambira or Utthana. Means, starting how it started, Purva Rupa. What is seen, manifested, Rupa, what we can see. Then comes Chirakari and Ashukari. Chirakari, whether it's a chronic one or acute one. Gambira, deep-seated or superficial. Depending on these, we can do the prognosis. To come to the conclusion of prognosis, Vyadigata. Then comes Pramana, severity of the disease. Here comes in the age also aspects, what is doshas also has to be taken care. Nidhana, etiology, the cause. Whether it was habitually or because of it has come as outside aspects, epidemic wise, Nidhana, reason. His food habits, his sleep habits, all has to be considered in Nidhana. Sadhya and Asadhya, whether the disease what is seen, whether it's a curable or incurable. This also has to be decided. Upashaya, Anupashaya, aggravating and pacifying factors we have to check in. If it is summer and Pitta Uddhi is there, burning sensation is there, excess sweating is there, what exactly? We can't straight away ask him to use all hot substances like Katudravyas, Tikshna Dravyas. No, we can't see. Chili powder. No, we can't see. There we give Upashamana, like Chandana, cooling aspects. So which pacifies, which aggravates has to be decided. Upadravas, complications. What are the complications we can see in a person of the disease? Has to be checked in detail. That is Roga Pariksha. The disease, what we are checking in, how it has happened, what has happened. Then comes our Rogi. In Rogi, we have to check his Prakriti, whether it's Vata Prakriti or Pitta Prakriti or Kapha Prakriti or Vata Pitta or Kapha Pitta or Pitta Kapha or Vata Pitta Kapha Prakriti, is constitution of him. His Ahara Abhyasa, lifestyle, what he is, when he is. This also has to be given a more importance. Vaya, Vasaya, profession, Vyavasaya. What type of job he is doing in, whether it's a hard work or an easygoing work or stressful work. Vyavasaya, Vyavasaya. Desha, the geographical influence. If I am Pitta Prakriti and I am staying in Chennai, there will be a lot of changes in me. That also has to be considered. Example wise, the geographical influence has to be checked into. Ritu season. I am Kapha Prakriti majorly. In a winter season or in a rainy season, I'll have Kapha resolves more. Season effects. What is going to cause on me? This is for the Rogi. Vayaha, age and avastha and the face. In what age I am? Young age is of Kapha Prakriti. There, we can get affected with Kapha doshas majorly. Old age is Vata Prakriti. There, I can see the Vata diseases more. Vayaha, my age and my phase of life, it depends. Linga, gender. Apart from the degree of severity of the disease, these host factors also helps in line of treatment in Linga. Whether it's a male or a female also has to be considered here. So all this above things has to be checked into, showing the proper line of treatment for anyone. This is because Pariksha Vidhi, when we come into examination aspects, Pratyaksham, Alpam, Analpam, Apratyksham. Pratyaksha, what I am seeing outside. Alpam, the whole iceberg is under the water level. What I can see above is Pratyaksha. It's Alpa. Analpam Apratyksham means whatever under the water level this iceberg is seen, I don't have idea. I don't have any information. Inferred things are not seen much to me. Means clinical examination has its own limitation. Even the reports, investigations also are inferred are not completely. Direct perception is very limited. That's what our Ayurveda master says. Unless and until we start attending, is difficult. Sometimes what we see or hear from patients will not be exhaustive to come to a conclusion. It's often like an iceberg, what I was mentioning about it. So this all has to be checked into. These are Pariksha Vidhis are there. How to come to conclusion. In Ayurveda, the physicians adopted many methods of examination, where we will be covering only few here. Majorly, we are giving importance to Trividha Pariksha. Dashavidha is there, Ashtasthana Pariksha is there, Chaturvidha Pariksha is there. But we follow Trividha Pariksha. What are these Trividha Pariksha then? Darshana, Sparshana and Prashna. Darshana is inspection. Whatever we see when a person enters, Sparshana, palpation. What we feel, the structure wise, we'll go in detail little bit. Prashna, interrogation, very important. Questioning. In Dashavidha Pariksha, we have Dushyam regarding the structure and functional abnormalities of the body. First is Desha, we have to check in. Geographical situations, where the patient comes into. Bala is a physical strength. Kala, the season and climatic conditions. Analam, the digestive system of the patient has to be checked. Prakriti, the natural Tridoshas constitution of the body. Vaya, age. Sattvam, physiological strength of the psychological strength of the patient has to be checked in. Satmam, general and personal habits of the patient has to be checked in. Aharam, nature of the food. Without all this, we cannot come to conclusion. Dashyam, Dashavida Pariksha, he gives in a detailed aspect about this, but we'll just know about the terminologies as and where we will be using them also in our clinical aspects. It's not that we are not touching them in a detail. When we do further, we'll be coming into picturization of this. Ashtatana Pariksha, Nadi, pulse we check in, Mutra, urine, Malam, fecal matter, Jihva, tongue test, Shabdam, voice and speech of the patient, Sparsham, touch, skin and tactile sensation we do, Drik, eyes and visions, Akriti, general body build. This is known as taken care in Ashtasthana. So if that is the case, what is Swasthya? Swasthasya Sukha Sadhanam. Anything to achieve easily, Swasthya, sound health is instrumental. Factors to responsible for health. In brief, we identify three major facts. They are known as Trayustamba, which support building. Trayustamba, Ahara, Nidra, Brahmacharya. Ahara is food, Nidra is sleep, Brahmacharya is celibacy. Each body constituency is health because of improper following all these things, the disease, the diseased condition, everything depends on this Triyostamba. Even who says, WHO, World Health Organization, a state of complete physical, mental and social, spiritual well-being, not merely the absence of disease or infirmity. This Triyostamba has to be dealt in detail and followed in detail of everyone to keep healthy. In Ahara, we have to take care of Subhava, some yoga, samskara, matra. Nidra also, we will go through that. Brahmacharya, what all we have to follow, we will go through into it. Thank you for today.